When we talk about medication-assisted treatment, or MAT, we refer to an approach to treat patients with substance use disorder where medication play a major role. And there are two main approaches. One is the agonist approach, which includes medication like buprenorphine or methadone. The other is antagonist approach with medication like Naltrexone, otherwise known as Vivitrol.
Vivitrol is a depot form where you inject the medication into someone's buttock in the muscle area. And what it does is it basically is dispensed throughout your body over time. So it stays in your system for a little over 3 weeks to a month. It binds to the opioid receptor and blocks it. You can't get the feeling of getting high. And that is so much more powerful than I think we ever knew.
Growing up, I grew up father and mother, 2 older brothers. There was no divorce, no broken home, nothing like that. I kind of had a very good group of role models growing up. But I wasn't ever going to be the student my oldest brother was. And I tried my hardest, but I could never be the athlete my middle brother was. So I found my niche, if you will, by being popular and partying and, having fun. So when I first tried drugs and alcohol, it was another way for me to stand out from the crowd.
And I knew that it was senior year and the kids like to party, but I never thought it would get into anything heavier than just a beer.
When I got to college was really where things kind of went downhill for me. I had gotten a lacrosse injury. I'd broken a bone in my foot, and the doctor I went to prescribed me Oxycontin 20 milligrams. I knew, thinking to myself, this is bad. Nothing should feel this good. If something feels this good and takes away this much pain, it shouldn't be in the possession of, a 20-year-old. I was hooked right away. It didn't take long for me to become an everyday addict. It was a horrible life. It's lonely, it's depressing. I had a really bad stretch. 2 close friends of mine passed away from suicide. One was from drugs. That's when I kind of derailed. I wanted to end everything. So I was up on the top of my apartment building, and I just couldn't bring myself to jump.
He had a terrible freshman year academically at school. Had notification from the school that he was basically on probation. Joanna and I talked separately. She called him, and I think she called me and said, you need to go get him.
And I was clean for about 2 or 3 months off everything. I went to hang out with some friends one night that summer. Someone mentioned Painkillers, and it was like I let the gorilla out of its cage again. I was back on them, and I was back on them worse.
Society, we all think, why can't these people, these patients, these addicts just stop? And it's not like that. They're not the same person once they become dependent on drugs. They're a different person. They can't get to those same skills that they once could get to because their brain is now rewired. It's only thinking about the drug.
I had been wanting to get off the substances for so long. Just hated myself. I didn't want to be this person anymore.
Mike initially convinced us that, he'd seen the light. He wanted this to end. He had been trying to do it on his own, but never was able to get more than a couple of days or maybe a week without using. And then he'd always find his way back to it.
Most patients who are using daily prescription opioids or heroin, they have to use those substances every day because if they miss the dose, if they don't use it for 12 hours, they start developing very uncomfortable withdrawal symptoms.
It's painful to go through withdrawal, especially if you've been on an opioid for a really long time.
Withdrawal from opiates is the single worst experience anybody could have to go through.
Once we realized that we had a much more serious problem on our hands, we knew it couldn't be handled on an outpatient basis.
He was first prescribed Suboxone, which he did try.
And it just wasn't effective. Because like I said, he could choose not to take it.
Vivitrol is very different in terms of who might benefit from Vivitrol versus who might benefit from methadone and who might benefit from Suboxone or buprenorphine. A patient who has, strong family support, who's highly motivated for treatment, who is aware of, what the risks are in terms of, the side effects and, what their treatment goal is very important too. If the patient is, hoping to have a lifelong plan of abstinence, then Vivitrol is a great choice.
The attraction of Vivitrol was it was an injection that was both a positive and a negative, and that once injected, you couldn't avoid it. Right. It was in your system. The bad news was if you fell off the wagon, you're liable to do something really dumb.
There are dangers associated with Vivitrol. If a patient, is on Vivitrol for a period of time and then they stop Vivitrol or they miss a dose, their tolerance now has dropped significantly. And if they were to now use opioids in the same way that they used in the past, they could potentially overdose. Vivitrol can cause depression in some patients, and you do really want to watch them closely and make sure that, that the depression doesn't get exacerbated or the Vivitrol is not exacerbating that depression. So that is something we always make sure to discuss at length with both the patient and, a significant other or a family member to make sure that they're aware of this.
It is necessary for patients to abstain from opiates before they can get started with Naltrexone. It's a trying time for the patient and for the doctor, but it can be with the help of medications. Many patients are able to go through this process. Most of the time, they do it at the inpatient setting in the hospital, but it can also be done in outpatient setting with daily visit to the doctor's office for evaluation and additional medications to take at home.
Typically when a patient's on Vivitrol, I like to have them stay on the shot for at least 6 months. I have patients that have been on it for 2 years and they just don't want to come off of it because they find it so effective and the quote-unquote insurance policy is just so valuable and warranted for their functioning that, why would they go off? People get on this shot and then they can function. In their own mind, they're not an addict anymore. That's so valuable. That's so amazing because now they can go to work, they can live their life, they can be in the relationships that they're in a different way.
It's important to remember that those medications are most effective when they're used in conjunctions with counseling, therapy, recovery work, self-help groups, many other ways that we know are very helpful for people who are trying to abstain from substances.
Counseling. This is important for so many reasons. Usually the first month is difficult, and then it just gets easier with time. And that's why it is so important to have, support systems like NA, like groups, like IOP, which is an intensive outpatient program, or outpatient programs in general, or a psychiatrist, or a therapist, or a social worker, just somebody that actually can see them weekly and kind of check in with them, see how they're doing, make sure, that they're feeling okay, make sure that their cravings are under wrap, making sure that they're functioning.
It's more than fair to say that Vivitrol helped me throughout my recovery. It was more of a safety blanket. It's a huge exhale knowing, even if I tried something, not getting high, doesn't matter. So why even bother?
Old-timer AAs may still say that, you're not really in recovery if you're on something, and that this isn't real recovery because you're taking something, you have a crutch. But that's really, I think we're kind of steering away from that. Smart recovery is kind of where we're now entering, where we'll do anything that's going to help us get to a place where we're in recovery, right? So anything that's going to work is the best treatment. And we've found now that medication-assisted treatment, actually, there's less relapses, there's higher levels of functioning, people are in better places emotionally, and they're not using. So why would we not use medication-assisted treatment, especially statistically when we're seeing that there's better outcomes?
I look at him, he's blossomed. He's his old self. Unfortunately, he's lost a lot of friends.
People say in recovery, once you start it, buy a suit. Or if you're a woman, buy a nice dress. You're going to be at a lot of funerals. I've lost probably 12 really close people, and I'm only 25.
The heroin epidemic is gotten outrageous, and there's, specials on all over the place. We're overdoses everywhere. We're talking more about, what's happening, the story, but not about how to help it. Seeing how many patients benefit from Vivitrol, from Suboxone, it's a life changer. I mean, this is why I love this job, because people get better.